All right, good evening and welcome to another Saturday Night Live with Dobbs. We cover various topics, introduce colleagues to you all. With me today is my friend and colleague, Dr. Say Fatt, who's a consultant obstetrician and gynecologist. Um, I will be introducing him because he's got some very interesting things to tell you. But first of all, before we proceed with Dr. Lee, I just want to wish everyone a happy Doctor's Day. Today, the 10th of October, is the Malaysian Happy Doctor's Day. And I wish all of you guys, frontliners, wish you well. Dr. Lee will be telling us about his website and his interesting content, which I think it's suitable for doctors to learn more, and also actually for public information and education as well. But because it's Doctor's Day, after Dr. Say Fatt finishes, I'd like to invite doctors to join us in the studio. We can have up to 10 people at one go. We'll see how it goes. There you can actually come in live and greet your colleagues, and also perhaps if you have questions to ask Dr. Lee, you can do so live as well in our studio. So without further ado, I'm going to pass over to Say Fatt, who has some interesting things to share with you. Okay, Say Fatt, all yours.
Thank you, Alan, and thanks for inviting me to actually share some of my contents in my website, and also to all the doctors who are actually listening in. Happy Doctor's Day. So Dr. Alan invited me here to actually introduce my website, which I created. My website domain name is very easy to remember. You just have to remember obgyn.com.my. 5 letters only, OBGYN. So it represents obstetrics and gynecology. So if you type the domain name, you will actually enter into my homepage, which is this one. So of course, there are some disclaimer here that you can read, and then when you enter, it will actually bring to my main page, which is the content, my blog, so-called blog, which I try to publish articles every few weeks. So the main purpose of this website is actually to disseminate information to, in fact, doctors as well as also patients. Because if you go and Google certain medical topics in the internet, you get various opinions and sometimes can be quite confusing. So I try to summarize some of these important topics and put it so that easy for patients and for doctors to actually find and read, and sometimes it's actually also more tailored to our Malaysian context. So if you look at the latest articles that I put up, it's called heartburn during pregnancy, which is very common during pregnancy. So as you can see, this was actually uploaded on the 4th of October this year. And from there, the format of my content, the content is actually very simple. Initially is introduction, followed by symptoms and signs, and what are the causes, of certain particular disease, and what are the risk factors that you should look out for. And of course, sometimes there are certain preventive steps that you can take. And also, there is also a section called what are the expected outcome if you undergo treatment or you don't undergo treatment. Then the complications that can happen, and what are the various treatment options available to you as a patient. Then also, when necessary, there will be some advice, either dietary or even physical therapy. So and the good thing is that because these are all with pictures and tables and all that, you can actually click here to download a PDF copy, which is the same thing. So you can actually print out and read if you don't want to read from the website. So, and you can, there's an area where you can actually subscribe, you know. So, and if you subscribe, you can do it here as well on the right side banner. If you subscribe, and if I put up a new content, a new topic, you will receive an email alert stating the title of the content, and you can actually click on the newsletter, and it will bring you to my website to read the latest topic. So these are all the recent posts that I've actually uploaded. But for the old articles, you can always go up to the menu and click on the menu bar here. For example, if you can go to obstetrics, which is related to pregnancy, as you can see, I have actually listed down all the topics here. Of course, some of the topics, I actually put a link, it's not written by me, put a link to certain reputable organizations all over the world that you can actually read a better article by them and a more comprehensive one. For example, Planning and Pregnancy from CDC USA. Then the rest are all my articles. So you can read about, nausea and vomiting during pregnancy. What are the things that you should do? And also, what are the vaccinations, for example? Okay. Then we have, for example, I show you vaccination. Sorry. Let me see. Vaccination. I have to actually share the screen. Never mind. Okay. Then these are all the articles that you can find related to pregnancy. So, and sometimes it's important to know what are the checklists that you have to go through in order to pack what is necessary to bring to hospital when a patient goes into labor, when they're going to hospital. So you can actually click here to download a PDF copy of the checklist. What are necessary things you need to bring to hospital and what not to bring to hospital.
I think, Say Fatt, sorry. I think earlier you were trying to show the nausea and vomiting one. I think it's because it went into another new tab. Yeah, new tab. May I just share that just so the others will see that it's actually there? I will just want to share that, and so that's when you click on that link, it actually opens another tab, and so that's the nausea and vomiting PDF article. Sorry for the interruption. So
no problem. That's what I wanted to show actually. So then, as there are many other topics, like postnatal care, what to expect after delivery. Things. What I wrote are actually more tailored towards what we do in Malaysia. So I think for patients who are staying here, I think it's much more useful than to Google something written for American women. And of course, if you plan to go for a cesarean section, you can read up all about cesarean section. If I click here, it will open up into another tab. Let me see whether I go to the latest news, whether I can find this. I just want to show you the example. Okay, search. Yep. Okay, if you click on cesarean section, this is what you're going to see. So everything about cesarean section, why you need to undergo the procedure, and what are the possible complications. And before operation, what are the things that you need to do, the preparation, and then how is it done? Following surgery, what to expect. Okay, so like I mentioned here, you expect a hospital stay of 3 to 5 days, and what will be given to you, what you should do, what you should not do, and the pain relief. So it's actually very detailed. and how to, in fact, there is also an explanation on how to get up from bed the following day. You are encouraged to actually mobilize early after cesarean section. Therefore, it's helpful to know how to get out of bed, because post-surgery is sometimes can be quite painful. So there are certain tips to help you get down from bed much easier and with much less pain. Also, as you go on, there are many other things that you can read about. It's actually very detailed. And also, I mentioned a little bit things about abdominal binder, whether is it necessary for you or not. So it's all discussed here, and what to look out for when you're home. Okay, so at the end of the day, you can click here, and it will open up a PDF copy, which has the same thing, of course, without the pictures. So then, if you go up to the banner again, here the menu bar, you can actually click gynecology, and that's where all the topics related to gynecology will be there. You can read about CIN, precancerous lesion of the cervix, and of course, what is colposcopy, for example. For example, if I show you CIN, let me, so that I don't want to go to another tab. Okay, so this is CIN. If you click, it will open up another tab and show you the content. What is CIN, which is a precancerous lesion of the cervix. So you can read up about it. And then there are certain pictures to illustrate, the description. And what is HPV? And the prevention for precancerous lesion of the cervix, we all know that we can actually vaccinate women against HPV infection. What are the complications of precancerous lesion of the cervix, investigation and diagnosis? So it actually contains lots of things. And what are the surgery required for these lesions, for example? Again, you can click and get a PDF copy. Then we go back to gynecology. I'm not sure, Alan, do you think the website is easy to navigate?
I think it's quite straightforward. The question is, people need to be aware about it. I think it's a good thing to have very educational and informative material on the website. The question I have for you is, can doctors share this with their own patients? Would you be all right?
Yeah. I mean, this is for the public. I put up this website is for any patients to read, not even my patient. Initially, 15 years ago, when I registered this domain name, it's very special, obgyn.com.my. So that was about 15 years ago, I registered the domain name. Basically, to put up articles, information there for my own patient. Actually, but the time I don't have much time to actually work on it, so the website was very badly managed, and the articles were all over the place. So that's why I didn't really disseminate the information, and I just kept it for my own patients only. But as time goes on, then I realized that, I need to expand it, and why not I share with the rest. So you're welcome to actually disseminate, go there, have a look, read it, and download it, and share it, And in the mobile format, if you use your mobile phone, if you read the article, there is an icon at the side there, which is a WhatsApp. You just click on it, you will directly open up WhatsApp, and then you can actually send it to your friends and whoever.
That's a very neat feature, because I think a lot of people use phones rather than computers nowadays to seek information, and sharing is actually excellent through WhatsApp, I find.
Yeah, you can see at the side here, you can share it through Facebook. Actually, I'm not sure what is it, the red color one. So
I think it's
Twitter. Is it Twitter?
No, it's Reddit. Reddit is
Reddit.
yeah. I don't know how many use Reddit. Reddit is billed as the front page of the internet, but usually got a lot of interesting stuff there. If you find your article in Reddit, you've made it.
There's you can send it by email to your friends,
Yeah.
or you can in fact click the icon there, you can print it out. So
Yeah.
it's actually quite easy. And if you're using your mobile, there will be one WhatsApp icon here. So you just
Okay.
click it and then it will open up WhatsApp. So yeah, as you, of course, this website is still work in progress. I think there are still many articles that I have not actually uploaded. I'm still writing it up and checking and proofreading. So as you go on, you can see that there are many more articles, and then you have family planning, which is only have 5 articles, so there are more to come. Then you have about information about fibroids and the specific surgery on fibroid removal. Okay, I think Ellen, can you click on the fibroid and open up that link? So it's actually,
Yeah. Hang on. Let me see. Fibroid removal. Huh? Okay. This one.
yep.
So yeah.
Yeah. So as you can see, so here I discuss about various type of fibroid and what are the different type of fibroid surgery that are available. For example, abdominal myomectomy, where you do an open surgery, and then you have the laparoscopic myomectomy, where you use keyhole, to actually remove fibroids. And then you have another type called hysteroscopic myomectomy, whereby you use a small little telescope and insert it into the vagina and into the uterus to remove a submucous fibroid, a type of fibroid that actually sits inside the uterine cavity. So this can be done as a day care. So useful for the patient to actually familiarize themselves with various options that are available. And then they can actually print out and go and discuss with their doctors, what are the type of fibroid surgery that is required. So, okay, then we go back to the main. Okay, this one, sorry, Ellen, just go back to the fibroid surgery.
Yep. Yep.
So if you go down towards the end of the article, of course, usually I put complication, what are the before surgery, during surgery, after surgery, what do and don't. So it's the same. So I actually try to, when I put up all these articles, try to follow a certain format so that when you read, it's actually easy and easy to understand and easy to follow before, during, and after. So this is after surgery, what to expect. So, okay, go down. Okay, so these are some information regarding fibroid removal. Go down. Towards the end here, okay. So again, there's a usual thing. You can download a PDF copy. You click, it opens up a PDF, another tab, a PDF file. You can print it out. Then you can read more about fibroid. And then here you can see that you can click here to view images of the specimen of the fibroid. These are real pictures of surgical specimen. Or you can click to view laparoscopic surgery, the video of the surgical procedure. So I will come back to the video later. But this, you see, not only you can actually read content, you can actually print it out, you can actually see images, and also you can actually watch a surgical procedure, a video of how the surgery is being done, so that you get a better understanding. If the doctor say, "Oh, you're going through a laparoscopic surgery," then you cannot imagine what is laparoscopic surgery. So if you just have a look at how is it done, then you have a better idea. Okay, Ella, we go to the main page again.
I have a comment from one of the dobbers. He says your illustrations are quite neat, well done, very informative for non-obgyn guys to refer when we meet patients pre-op. Yeah.
Yeah, and
thank you for the comment.
Again, yeah, thanks. Again, if you look at all my pictures there, they are all taken from non-copyright one. So copyright free, meaning free domain. So not for commercial purposes. So all these pictures and many of the medical illustration, actually I asked someone to draw it for me. Did someone draw it for me? So that because we cannot take from textbook without permission. So a lot of medical illustrations are actually my own one. I get someone to draw for me. So it actually requires a lot of effort and a lot of planning. Yeah. If you look at some of the pictures are actually hand drawn. Okay.
You want me to share the video or the pictures?
We come back to that another chapter later. Go back to the main page. Just now the.
Okay.
Okay. So as you go down, so again there are many other topics that you can actually go through. And I have a 3D animation. These are all, some of them are linked to YouTube. Okay, and what are the investigation normally done in gynecology, and what are the surgery also as well. So you can actually read up about certain surgery. These are incomplete. I will still update it later on. Okay, and then and some of the articles that I've written in media publication. Okay. Then I will go to media. Okay, I will start off. There are two types of media subheading here. Medical images. Okay, fibroid surgery, fibroid for example, and cyst for example, and then the medical video. Okay, I go to obstetric first. So sometimes patients when they are pregnant, they are curious to know how does a baby looks like in the mother's womb. They can just click here. Alan, can you do that? Because it opens into another link in you click at 12 weeks, click at 12 weeks. Yeah.
Hang on, yeah.
I hope it's still there. It's in the YouTube.
Let's see. All right, I will hang on a second. I will share that.
Yeah, so it's a video of a baby with a beating heartbeat. You can see the heartbeat. So for first time mother, they see, yeah, it's actually very exciting. That's a head, So you can see baby moving.
The head is on the right hand side, is it?
Right, yes. That's a head. You see the baby moving a bit. So, and that's the heartbeat.
The color Doppler.
Color Doppler, yeah.
Yeah, it's red. Where it's red, yeah.
Okay, so Alan, don't mind going back to the main page. So I have video for 8 weeks pregnancy, 12, 17, and 24. If I have more time, I will put on more. So like I said, this work in progress. Then you can go to gynecology video. Here I have lots of videos. So we have videos on hysteroscopic surgery. We have videos on laparoscopic surgery, and then for general practitioner who does Implanon insertion, I actually put up a video on how to do an Implanon insertion. Implanon is a contraceptive device that is injected under the skin. So I've trained quite a lot of GPs to do Implanon insertion, but the problem is if they don't do it very often, for example, 2 or 3 a year, sometimes you tend to forget how to do it. So I actually put up an instruction in YouTube how to do Implanon insertion. And surprisingly, this video in YouTube had 900,000 views, which is, I
Wow.
think, amazing. 900,000.
900,000 views. Amazing. Shall I share that
Yeah.
one? I'll
Yeah,
share
just have a look. You click and see.
yeah. Wow. Okay. Implanon.
So I'm going to join the million.
I'm jealous. Hang on. I think I'll share it again because I forgot to share with audio. Give me a sec.
There's no audio actually.
Oh, there's no audio. Oh,
There's no audio.
okay. Implanon, no audio. Okay, never mind. I share it again. Sorry. I'll play it full screen.
Because all my YouTube's video, I have not reached that stage there where I put up a video narration about
no, the fact that you got video at all is fantastic. Well done. Great job.
And instead of audio, I put instructions, written instructions, step by step. It's so they can actually have a look before they do the insertion. And I had more than 900,000 views. I'm not sure now is how much, but I haven't actually followed up. It's just injecting local anesthesia. This is the device that is used to insert the implant underneath the skin. So it's very simple actually.
Patient is anesthetized already, so it's quite painless. I guess you can reassure people watching.
Yeah, it's pain because local anesthetic has been given, so it's actually painless when you insert this applicator. That's it. Done. They can feel the implant underneath the skin actually. Then you just put a bandage over it. That's it. Done.
How long is it kept in for? For somebody like me, 3 years.
3 years, yeah. You can remove it after that and then reinsert a new one if you want to.
Amazing. Okay.
Yeah, just a few minutes procedure only.
Great. I think videos like this make a big difference, rather than just pictures and illustration. Really helps. Yeah.
And I think by talking also sometimes a bit difficult. So that's why I put instructions they can read so that. So as you see, I got lots and lots of videos of laparoscopic surgery for myomectomy, hysterectomy. So you can read up. Patient can read actually on it. Okay, so these are various videos. Finally, I have a section on medical books. Okay, so I think medical reference is very important for knowledge. So this is, I published a book in 2007, I think. Yeah, 13 years ago. So it's still available in University Malaya Bookshop. These are mainly for doctors, GPs, house officer, medical officer. And then I have another book, which is called Quick Management Guide in Emergency Medicine. You can download for free here. This was actually, there's a story behind this book. This is actually a second edition from a small book, which is this, called the Emergency in Internal Medicine, actually written by Dr. Wong Yin On. Okay. Wong Yin On. So it's actually, this was published, I think.
Dr. Wong Yin On is, some of you might know him as Puna Wong. Yeah. A medical educator down in Johor, and he runs a website, a Facebook group called Equanimitas, actually, which is very educational for medical students. Yeah, he's still very active in teaching. So
So this
yes,
was published in this was published in 1988. So, and it's a very, very good book. It's a survival guide for house officer, for medical officer. So, because it was such an old book, so I decided to update it, and so I did it with him and invited many specialists to come and contribute and update the various articles. And Alan Tay is also one of the author who actually updated one topic in this book. So you can download it for free and park it in your handphone. Now, I always, when I was teaching medical students, I always say, no matter how good a textbook, it's useless when you need it at 2 a.m. in the morning when the nurse call you to come and resusc a patient or come and manage a patient with acute emergency. So sometimes you cannot remember what is the drug dosage of specific drugs, and if you try to memorize it and recall, then it becomes very dangerous because you tend to make mistakes. Nobody can remember actual drug dosages and how to calculate drug dosages. You have to actually refer. And at 2 a.m. in the morning, you don't have books in your pocket. You don't carry books. Right, Alan? Nowadays,
oh,
many people
oh,
don't carry.
yeah, we don't carry books nowadays. We carry this,
Yes,
so we keep
precisely.
our books there. Yeah, our
Yes,
references are in there.
precisely. That's why I think this type of books should be in a ebook format. That's why I updated it, published it as an ebook, and put it up for free so that every houseman medical officer can download it and put in the phone. So if they are faced with any critical medical emergency, they can just refer. And the best is these are all can be searchable. You type a keyword and then you go straight to that chapter. Type a certain drug's name, it can bring you straight to that section. So it's actually very useful. And if times permit, I will try to update it some more, and update the book and then put it up again. Maybe version number 2 or something.
Yeah,
So
it's great. I think it's a good thing. I mean, when in my houseman days, we had lab coats and we were stuffed it with houseman guides and various
and the notes, isn't it?
notes and stuff. It's terrible those days. So you go
Yeah.
to the wards, very nervous, not knowing much information, always trying to refer, and we had to refer to paper reference. Now, I think the doctors have it so easy. Everything it's in a little book, in a little phone. You can keep so much information. This is your computer too. You can search and online and all that. So e-references are the way to go. There are apps and stuff like that. So I think this is basically our peripheral brain nowadays. So with reference like what Dr. Lee and Dr. Wong In Yon have put up, I think it's superb. I think especially for junior doctors in the ward where you may have to deal with emergencies, you just want a quick refresher. That it's with you all the time. Yeah.
Yeah, you can buy a book, that is 1,000 pages, very comprehensive in emergency medicine. But when you at that point in time you want to look for certain information, drug treatment, it's very difficult to sift through a 1,000 page of ebook. So you want something which is practical, management orientated. That you straight go to the management. So this is the intention of the book. So I hope it's useful. Okay, Alan, I think that's it. That's my introduction to my website, and I will continue to improve on it, and I will keep writing articles and try to put it up in the latest news section. The next article will be on vulvovaginal candidiasis.
I think it's a superb job you've done that, Say Fatt. I mean, this is a great resource for gynecology and obstetrics for doctors and patients alike. So if they can refer, read up, send to patients, so they can be. I think nothing better than to be fully informed, whatever it is. Yeah. So once again, today is Doctor's Day. Feel free to ask any questions or comments. You can please type in the in Facebook or in YouTube where you're watching this. The other thing I would like to invite you all. This is Doctor's Day after all, so please also feel free to join us in the studio. Now I've actually put up the links to join us in the live stream in the Docs Facebook group. So you want to say hello to your colleagues. Please open this up in a browser, not in Facebook app, because it won't work very well. You just copy the link and paste it into, say, Safari if you're using an iPhone, or in Chrome browser. So the link, and I'll post it in the Docs Facebook group, and I'll also paste it in the Telegram group. I invite you all to join us, and me and Say Fatt in StreamYard, where we are streaming from our studio. All right, let me put up the link in Telegram. Okay, so if anybody wants to come in, please click on the link, allow your camera and the microphone, and then hit enter studio. And then once you're in there, please put your real name, and then I'll let you into the stream and have a chat with us. So at least say, if you feel like asking Dr. Lee Say Fatt any questions directly about his work in his website, opgyne.com.my, or you want to just say hello to your colleagues. So just do come in. Don't be shy. It's dead easy. I think it's easier than Zoom as well to come in. So yeah, let's see. Nobody, Say Fatt, all just want to watch only. Yeah, but anyway, Doctors' Day in Malaysia is 10/10. We don't follow the international or United States Doctors' Day. That's another month. So it's been celebrated, I think, since for the last 6 years on this date, and it's quite easy to remember 10/10. It's also World Mental Health Day, so I don't know what that means when you have Doctors' Day and Mental Health Day all together. but I think in the times of COVID-19, people are getting very stressed. So I think I wish everyone, all you frontliners, also stay safe and also stay sane, and try to de-stress whenever you can. And one of the ways is to, network and rely on your colleagues to support you. So we are all here in the DOPS community. Sometimes people like to let off steam, or just crowdsource for information, and or get the latest on what's happening in all the different hospitals and places in Malaysia as far as COVID-19 goes. We may not have all the information you get in the media, mainstream, or whatever. So for reliable information from your colleagues, do join us in DOPS, either Facebook group, which is closed group only for doctors, over 16,000 participants, and also our Telegram group. Okay, nobody wants to join us in the studio. I think generally people are quite shy. I don't know why. But there is one comment from Dorothy. Dorothy is a GP in Penang. So Dorothy says thank you and happy Doctor's Day too. So thank you, Dorothy.
Yeah,
Say Fatt, do you know Dorothy?
No.
She's also UM grad. Yeah. Okay, Dr. Lim Yu Chen has a question. What common mistakes GPs do in cases referred to you?
Actually, I don't see any mistakes, by the fact that they refer, they have already realized that the patients need tertiary care and a specialist consultation. So I don't think so. The fact that the GP make a referral and advise the patient to see the specialist already, I think that's a good management. So I seldom see referral that is unnecessary. Most of the time, the referral is actually warranted. So I don't think it's a mistake by referring, because you are not sure. And most of the referrals are actually warranted.
I think when we refer, generally it's because it's out of our sphere of expertise. We can't handle it, so we tend to refer. But are there instances where referrals might be a bit on the late side, or could have been earlier, that sort of thing?
Oh yeah, there is, but so far I don't think there's a big issue now. In obstetrics and gynecology is a bit different in the sense, especially gynecology, because a GP don't have the privilege of doing on-site scanning A patient comes with a problem, we can examine the patient, do an internal examination, looking at the cervix, looking at discharges, and then perform ultrasound scan at bedside. So we have the luxury of a non-invasive and a very accurate imaging modality at the bedside. So we can actually make a diagnosis there and then. But the GP don't have that kind of luxury. They don't. So they just base their diagnosis on clinical history, some external physical examination, for example, and then some simple blood investigation and urine investigation. So even I can imagine, even I'm a GP, I will find it very difficult to actually manage a lady who comes with a gynecological problem. So it's not easy. Therefore, I think if you think that you cannot manage or you cannot do a full examination and if you're not happy with your assessment, I think it's a good practice to actually refer.
Okay, Dr. Kaur has a question. As a friend, 34 years, last 2 pregnancies end in miscarriage. How to proceed?
Well, miscarriage, if you have miscarriage in the first trimester, meaning before 10, 12 weeks, so these are quite common. So usually is unexplained due to usually congenital abnormality that we think it is. What you need to do is to do some basic investigations, blood tests, to rule out any abnormality, and then you actually need to do a basic ultrasound scan. Okay, you need to do a simple scan to make sure that the uterus is normal shape, there's no fibroids, there's no pelvic masses in. So if everything is normal, normally at 34, the outcome is still excellent. They will have a successful pregnancy in about 70, 80% of the time. So just if everything is normal, just reassure, take supplement folic acid, and then try to conceive again. Invariably, many of them will have a successful pregnancy. So there's a definition of recurrent pregnancy loss, recurrent miscarriage, and it's actually labeled as 3 concurrent miscarriages. So, but again, that is definition 3. But if in the older women, for example, she's 38, 40 years old, anybody who had 2 miscarriages should be investigated for a possible treatable cause.
Okay, I don't think we got any more questions. Last chance to join us in the studio. Yeah, but anyway, it's been a great session with you, Say Fatt. Thanks for sharing your website.
Yeah, I'd like to congratulate you for your job well done. You have gone to great lengths to actually set up all this and.
No, I think yeah, live interaction is also very productive, and I think when we have CPD and chit chats like this. So our Saturday evening is just for general chit chat. If people got issues, they can ask us, or if we want to highlight colleagues' work, like your excellent work, we can do so, or in any burning issues like we had for APC application and all that. I think this is quite an interesting medium. And then for CPD lectures, just to remind you all, it's usually on the Wednesday. So our next one actually is on the 14th next week. And for those of you who haven't seen or registered yet, please come and register so that we can send you the exact link. This is the event flyer. Just check. So Ms. Shanti Abraham is a lawyer, and she's going to talk about medical mediation. So this will be next Wednesday, 14th October, 8 to 9th. So you just need to go to https://dops.my/cpd, and then please register there. so that we can tell you the exact links in the DOPS Facebook, or just give you a general reminder what to do. Okay, when how to view it, and this will come with CPD points. So I think that's also quite popular nowadays. People just like to view and then scan the QR code and get the CPD point. But hopefully people learn something out of it. And the best part of it is also like this, it's interactive. So you can ask the speaker questions and the speaker can respond instantly. So I think some of your things can be interesting talks, Say Fatt. So maybe in the future we'll have something from you. Yeah.
Maybe. Alan, there's Dr. Leong Hin Ko say that apparently the ONG says normal. Yeah, that's why I suspect most of the time in a healthy normal women who have 2 miscarriages, if you do investigations, even including an ultrasound scan, most of the time is actually everything is normal. So all we need to do is just to reassure her and ask her to continue her folic acid, and then eventually she will have a successful pregnancy in majority of the women.
So most of the time, no underlying cause is found. Is that true?
Yes, yes.
So, okay.
So maybe I will actually have to put up an article on recurrent miscarriage. In fact, in my website, there's an article on miscarriage as well. So you can actually go and read it.
So, yeah, just one more time, just to remind folks, you can find all Dr. Lee Say Fatt's articles at his excellent website. It's opguide.com.my. So the PDFs you can download, you can share with patients, share with colleagues, and also there are videos, links to videos also if you want to see. Okay. So, all right, I think we've taken enough of Say Fatt's time, and I want to thank everyone for watching. Thank you once again, Say Fatt. Oh, there's one, one comment. Oh, thank you for everything. Thank you. Yeah, thank me. Yeah. Yeah. Anyway.
Okay, thanks, Alan.
Yeah. Okay. Good night, everyone. So I'm going to end the broadcast now, and see you on Wednesday for Miss Shanti Abrams' talk, and then next Saturday again for our usual live chit chat here, both at 8 p.m. Good night, everyone.
Okay. Good night. Thanks, Alan. Good night. Bye.
So